see a lot of 30 to 50-year-old guys that are traders and hedge fund guys, and they let their butt get a hold of their intellect, and they're working themselves to death, and they got kids and wives that are unhappy because they're never home. They're up at 3 a.m. because of international business, et cetera, and they're traveling. And they get all strung out. And the next thing you know, to get up there to do an Adderall to go to bed, they're taking Xanax and they're drinking, and they say, look, I got to get off this. I get off this. Yeah. So I have really a fairly robust NAD practice where I do a string of 5 days of NAD at 800 milligrams IV drip. And it literally clears the brush in front of them after 5 days.
Welcome to the Peptides and Longevity podcast. Each week, we'll dive into groundbreaking science, innovative therapies, and the future of health and longevity. Alongside visionary physicians and experts, we'll explore how peptides, cutting-edge medicine, and lifestyle strategies can redefine the way we age. Get ready to transform your health, optimize your vitality, and unlock the secrets to a longer, healthier life. Let's get started.
Hello, this is Dr. Kent Holtorf with another episode. Today we'll be talking with Dr. David Calvo, orthopedic surgeon. He's going to talk about peptide solutions and orthopedic surgery in musculoskeletal and regenerative medicine. Dr. David Calvo earned his undergraduate degree in microbiology from the University of Texas at Austin. He then completed his master's degree in cancer research at MD Anderson Hospital and Tumor Institute and the University of Texas Graduate School of Biomedical Sciences in Houston. Very interesting background. Upon completion of his master's, Dr. Calvo obtained his medical degree from the University of Texas Medical School at Houston, completed his surgical internship and orthopedic surgery residency at Herman Hospital. He completed his fellowship in sports medicine, arthroscopic surgery, and reconstructive knee surgery at the world-famous Steadman Clinic in California, and reconstructive surgery of degenerative joints at Princeton Margaret Rose Orthopedic Hospital in Edinburgh, Scotland. That's interesting. Man, you've had a lot of training. Before coming in to the Austin area, he developed the Travis Orthopedic Sports and Spine at Lakeway Regional Medical Center. He participated in Sugar Land and the surrounding Houston metro area for over 28 years. He is board certified, American Board of Orthopedic Surgery, and was a fellow of the American Academy of Orthopedic Surgeons, special interest in sports injuries and artificial joints and upper and lower extremities. He served as a physician and surgeon for thousands of patients, including amateur, collegiate, and professional athletes. He is an accomplished triathlete himself, a sports enthusiast, and competing for over 20 years. Pretty amazing. He and his wife, Diane, live in the Austin area, and they have 2 adult sons and 2 grandchildren. His current passion, I'm gonna ask about this, what made, he's an orthopedic surgeon. Why would you want to change into regenerative medicine? And based on many years of study and utilization of regenerative autologous and allogenic components, including bone marrow aspirated concentrate, adipocyte and pan vasculocytes, as well as amniotic materials, exosomes, and medicinal signaling cells, which used to be called mesenchymal stem cells. He has developed numerous very successful methods, adjunct and sometimes replacement techniques to assist injury and surgical results to replace or delay surgical procedures, and a spectrum of medicine and surgery. And current research and guidance by regulatory agencies is further focusing his attention on treatment efficacy and safety for patients. That's a mouthful. Additionally, Dr. Calvo has become extensively trained in the science of clinical application of human peptide therapy, and is a member of A4M and honored with certification by that organization. He used peptides as standalone therapies and also as combination therapies. So very extensive history and impressive schooling there. Welcome, first off. Thank you for taking the time to be with us. What made you go from orthopedic surgery to this regenerative medicine?
Well, I've always been intrigued by what we refer to now as the terrain theory. I trained in microbiology, which is Pasteur's germ theory. But no matter what I did, it seemed that there were components that defied the treatment program that were based upon what I only knew of at the time as the cause of disease, which was the germ theory. And as I became more and more knowledgeable of the fact that no matter how good a seed you have, if you plant it in bad soil or bad terrain, it won't do well. So many of my patients throughout the years were older or were in poor nutritional status. And as I became more and more knowledgeable of this, as I begat a personal selfish knowledge of what would keep me healthy and going longer, I began to realize that this is applicable to my patient population, and if I made them more optimized, that my results would probably be better. And lo and behold, that is exactly what happened.
So did you originally look into this kind of for yourself, being an athlete, trying to optimize your physical performance?
Of course, as athletes are always trying to get an edge. And, I can remember back in the high school days of using Nutrimint, which was a canned protein drink, which nobody knew was in it, but it made us feel better anyway. It tastes good. But as we moved along, and I would say more of what was, I would classify as a deficit in my performance as I grew older in my 40s and early 50s, led to my interest in finding out why. I was 45, 48, 49, and in a roaring orthopedic practice. I could have seen 3 clinics a day. I had so much business. I was doing 800 cases a year, and I found myself not being able to get out of bed in the morning. Well, I was, what the hell? How could I possibly? I got like world by the tail, and through some experimentation, if you will, with laboratories and such, I realized that I was thyroid deficient. I was vitamin D deficient. I was testosterone deficient, nutritionally deficient, et cetera, et cetera, et cetera. And I didn't feel like I was practicing too bad a lifestyle, but I mean, that was at the point where we were still doing IHOP and donuts for breakfast.
Yeah.
And I mean, we all did that.
Now you're an orthopedic surgeon. You're not supposed to be asking these questions.
Right. Well, it kind of slapped me in the head.
Yeah, see, I think so many people that get into this specialty or whatever, whatever we want to call it, it's usually, and I was very evidence-based, still am, and it was just ingrained. Anything alternative, I hate that word, like there's no evidence. And well, yeah, if you don't look, you don't know. But then when I got sick and found they had nothing for me, and I snuck out and went to these, those crazy people, I'm like, oh my God, they're more evidence-based than what we're being taught, And
the problem is that our brethren, our historical forefather brethren, have what I refer to as a sometimes fatal disease called psychosclerosis. It's hardening of the attitude. And I've never been one of those guys. I was trained in that world, but I'm not of that world. And I've always been looking for better ideas and better suggestions as to what to do to improve my surgical techniques, to improve my rehabilitation techniques. And one thing that Stedman taught me was you can do as good a surgery as you want, but if you don't do the right therapy, and if you don't start it on time and do it aggressively, your result's going to be subpar. And the reason I did my fellowship with Stedman, because I read all of his clinics in North America in orthopedics, and I understood that he had a different animal. He took a lot of these patients home, Phil Mayer, Steve Mayer, Cindy Nelson, yada, yada, took them home with him, and they stayed in his basement. And the day after their surgery, he did their rehab before he went to work, personally.
Wow.
So I learned from this man that there was a different way to do this. And so when I built my practice, I built half of my practice as a rehab facility, and I joined them. So I had athletic directors, so I had nutritionists, I had nurses, and I had, physicians, et cetera, in my practice that helped me run this thing. And in spite of that, I burned out. But I burned out because I wasn't taking care of my health, and because I didn't know how. You and I came from the generation that testosterone causes heart disease and causes prostate cancer.
Yep.
Right?
Yep, exactly.
And you don't need vitamins. All you need is 3 squares.
Yeah, it's just all you're going to make is expensive urine.
Exactly. We've heard that's a euphemism. So, and in fact, now what we know is we want to have expensive urine.
Yep.
So anyway, to get on with what we came to talk about today, we're going to run out of time.
Yes, I know you have to go. So, but yeah, so you have a PowerPoint, and most of the time we don't. But the
but what I'm going to do is I'm going to put the slides up, and I'm going to talk about those things as much as you want to, and then we'll move on. Okay?
Sure.
Enough about me and such. It's just that my evolution was like most of our evolutions as a result of something that happened to us or with us.
Yeah. Yep.
All right. So my specializations now are relevant but not important to the subject. But bioidentical hormone therapy is, as you know, is very important. Peptide therapeutics, very important. That's what we're talking about today. In bone, muscle, tendon, sexual function, sleep issues, hair loss, and many others. The regenerative medicine that I do on a day-to-day basis includes PRP, regenerative growth factors, and the FDA won't let us talk about exosomes and perinatals and things like that. They've decided after 30 years that those are dangerous and they need safety studies. Well, I've used them for 30 years and never had a complication. So nonetheless, that's neither here nor there. I can't fight City Hall on that. So I do fat-derived, and I do PRP, and I do bone marrow, regenerative medicine stuff because it is grandfathered under the previous generation of rules and regs that orthopedics has been grandfathered into until we get the IRBs and INDs and everything out of the way so we actually prove safety on what we already know is safe.
Yeah, so the exosomes are now termed decellularized growth factors.
Yeah, I mean, they're basically water balloons that come out of the side of cells, and they've got all kind of goodies in it, and they're care packages. And they have autocrine function in the cell, they have paracrine function outside the cell, and then they have endocrine functions long way from the cell.
Yeah, can you kind of just take that to a more lay person, just like what an exosome is compared to a stem cell?
Well, a stem cell can reproduce itself in the right circumstance. And all of our tissues have stem cells, whether they're muscle, bone, brain, heart, kidney, whatever. And the essence of aging is the deficiency of stem cells and regenerative factors. And ultimately death occurs when those regenerative factors fail to keep up with the degradation. So we no longer can keep up with regenerative aspects of our degeneration, and we fail and we fall apart. It's like an old car that just quits. And then on top of that, if we throw that into the mix of what happens in the hypothalamus and what happens in the rest of our bodies with peptides and things like that, which is the subject of our conversation today, these stem cells have the ability to produce, depending on where they are, have the ability to produce peptides and hormones and things like that, whether they're from the pituitary, the hypothalamus, the adrenal gland, the testicle, the ovary, whatever they are, wherever they are, they can produce these amino acid stacks, if you will, naturally. And what we've done in medicine now is we've learned how to stack these things synthetically in a way that they mimic biology. And so the stem cell is the kind of the origin of life, if you will. It's a specialized cell that can reproduce itself and also affect the surrounding cells that aren't stem cells by exuding exosomes, which are mini care packages, like taking the MINI care packages, like taking a rocket to the space station and replenishing the food and the fuel and the oxygen and all the things that go on up there. These exosomes are exuded from stem cells and are in the milieu of the intracellular space, or they actually merge with the cell wall of the surrounding cells and actually dump their contents into the surrounding cell, just like what happens in the fertilization process of a sperm and an egg that merges with an egg and it dumps the DNA contents and starts the beginning of life.
I'll just mention, because like so many people, they think of stem cells, you give them, they go to the area, start growing and replace that tissue, and they don't do that.
No.
In fact, some studies show, for instance, they'll induce a heart attack in an animal, whatever, and they'll give stem cells and it helps repair it. Then they'll give a second set, the same stem cells, but they'll keep them away from the heart, so they can't make it to the heart. And the repair is exactly the same. So they're sending out something to basically heal that, they're not going there and turning into cardiac cells.
Oh, I mean, the stem cells, not unlike other organelles, like mitochondria and such as that, they have their own proteins, their own peptides, their own RNA and DNA and everything else. What happens is they don't have the replication. Stem cells have replication capabilities, but they really don't once they're given allogeneically. Now, we do know that there's a difference between cancer therapy.
All right, so you're diving deep into peptides and longevity on this podcast, and we're right there with you. Integrative Peptides stands out, trusted by over 10,000 doctors to deliver real results for their patients. These premium peptides are your key to unlocking vitality, recovery, and a longer, stronger life. Visit integrativepeptides.com and use the code PODLIFE for 10% off your first order. Again, integrativepeptides.com. Use the code PODLIFE for 10% off. It's time to elevate your journey, starting now.
We're talking about, basically, the different ways that you practice and how you got into this and how you got into exosomes.
Yeah, so let's motor through the different, our purpose is peptides, but let's talk about the basic cellular components herewith. And so exosomes basically are expressions of the cell wall with intracellular components, which include nucleic acids and proteins and various other and sundry things from within the soup of the intracellular milieu. And those things are passed on to either the surrounding extracellular fluids or in fact merged with and entered into the surrounding cells in what we refer to as paracrine. And the autocrine means what happens in the cell, paracrine, which means what happens near the cell, and endocrine happens distant from the cell, like from the hypothalamus down to the testicle. The hypothalamus is in the brain. So we can actually have three different ways that these things help. They help themselves, they help the neighboring cells, and they help distant cells in the systems. So exosomes are an expression of a cell, and they can be and they're almost always an expression of the stem cell from which they are mothered. The industry has been able to replicate and grow up cultures of mesenchymal stem cells or medicinal signal cells, if you will, depending on whose terminology you use, and whether you're talking to Dr. Kaplan or somebody else. But those cells then can be milked, so to speak, just like milking a cow. You keep the cow in the barn, but you take the milk to the store. And so the exosome and its contents are the milk, and you supply the nutrients and the well-being to the surrounding cells and distant cells via exosomes, and you never have to use a stem cell to do that. So it's kind of a novel idea. Now, going back and retrograde back to the concept of giving stem cells, and we were talking about cancer as being, we want to replicate in the bone marrow lymphocytes and leukocytes to regrow the bone marrow that we wiped out because they had a cancerous immature cell inside the bone marrow that was going to kill the patient. They got rid of them and then replenished them with stem cells from themselves if they were stored at birth, or from a twin sister, or from a donor. That's a whole different animal. There are stem cells that can be, that we use, that can be derived from virtually any tissue. And the cells that I've used thus far started out in the realm of bone marrow because I'm an orthopedic surgeon and I live in bone. So we can extract bone marrow in the operating room when we're operating and actually put that into a fracture or a knee or whatever tissue that we're operating on, whatever's injured, and it can accelerate the healing process. And as what you said, we're not counting on necessarily the replication of those cells that we're extracting and reinserting, whether they're perinatal or autogenous or perivascular or lipogenic or whatever they're coming from. It doesn't really matter, because if you tag those things and if you tag them with a radioactive tracer or whatever, you really don't find them after more than 5 to 7 days. In rare cases, now and then you'll find one in the lungs or somewhere where they've set up camp, but they don't reproduce themselves and they won't grow a liver. That's not their purpose. What they do is they supply the substances that are within them by either the cell wall of the stem cell destructing and spilling its contents, or by exuding exosomes or whatever method reveals the contents within. And those substances go on to make the surrounding tissues more normal. Interestingly enough, they don't really affect normal cells. They affect abnormal cells. If a cell's good, they don't supercharge it. They just go to work on things that are not right, and they optimize them.
And they can also stimulate that tissue stem cells to then, repair the tissue as well.
That's exactly right. They can reconstitute the wellness and youth of the surrounding stem cells in the tissues that are part of the nascent stem cell population in the patient, and they can supercharge those cells to make them better by virtue of the supplies that they give them. There's a lot of stuff we don't know yet. And a lot of this stuff is propositional, if you will.
I mean, that's medicine. The more you learn, the more you know you don't know. I think that's the problem. It's the doctors that think they know everything. They're, the ones that know the least are most adamant they're right.
Exactly. So if we go on to the next level, which is peptides, which are components of stem cells, the cellular milieu within the stem cell, the cytoplasm, if you will, they're also exuded outside the cell in form of exosomes, and also just exported through the cell wall, through pores, etc., lysosomes, whatever. And they can be expressed from the thalamus, from the hypothalamus, say into the pituitary, and turn on components of the pituitary. For example, let's just use for a minute CJC 1295 with ipamorelin, or any of the other growth hormone releasing hormones and growth hormone releasing peptides. They basically can turn back on a deficient or slow pituitary to specifically produce a certain necessary hormone or prohormone that the body has become deficient in. We learned very early on that if you take an old man who's 80 years old that died, unfortunately, and you biopsy his brain, take the pituitary, grind it up, and measure the growth hormone in it, his growth hormone, for the most part, is the same amount, quantity-wise, concentration-wise, as a 21-year-old pituitary, but the difference is the releasing hormones, the growth hormone releasing peptides that release that growth hormone are not around, and they're deficient. It's kind of like having a skydiving plane full of parachuters, and you got one guy stuck in the door and doesn't want to jump, and you got the instructor puts a boot in his ass.
I have not heard that analogy before.
But that's in essence. I mean, it's more of an orthopedic analogy, but it's a concept, a mechanical thing, or maybe a chemical thing, that they found that if they give a combination of a growth hormone releasing hormone with growth hormone releasing peptide, they get a normal 8 to 10 pulses of growth hormone a day instead of a plateau that you get by giving growth hormone, which is a much more physiological, normal way, and the body knows what to do with that. What it doesn't know what to do with a flat or a decrescendo flat plateau of growth hormone. It doesn't quite know what to do with it. And you don't get the side effects from it, et cetera, that you do from growth hormone.
Yeah, because you can't overdose. It just stops working if you try to overdose in it. Do you use more growth hormone? Like, do you inject it in the joints as well, or?
I haven't injected growth hormone in the joints because I'm not sure I need that. I haven't injected. I'm not sure
it may be most of it's done through IGF-1. Most work. And I think what I was trying to get at, I guess, was that, with growth hormone, you look at, send the blood to the lab sends back 95% of the people is normal. So the highest and lowest 2.5% are considered abnormal. And most people they take are sick. And so the growth hormone normal is so low that it's crazy. So that you go to the doctor says, oh, your growth hormone's normal. It's like saying you got a D-.
Same with testosterone.
Yep. And for the same, every decade, they just lower the normal range.
So, and I tell my patients, right or wrong, I think I'm right, but I tell my patients that my idea is to optimize you to a 35 to 40-year-old man or woman for the rest of your life. And I want to do it in such a way that I don't endanger you. And I know that IGF-1 in an elderly patient could potentially endanger them because it could promote carcinogenesis in some people. So I aim at trying not to raise their IGF-1, but raise their growth hormone level. And the other thing,
I did a review. I looked at every single study published up to that point, published my results. No study has ever shown giving growth hormone causes cancer.
well, and I love to believe that, but I don't want to give somebody growth hormone and they get a cancer and they end up in some attorney's office and say, it's kind of like testosterone causes heart disease.
Right,
Testosterone
there's
causes
medicine, and then there's, and now I do have a little concern of giving IGF-1.
I do too. I do too.
Now, growth hormone will cause, IGF-1 in a test tube is going to stimulate. It's a growth factor. It's going to stimulate growth. Now, IGF-BP3, so will make both of those actually is very anti-carcinogenic.
Right.
So they balance out. But yeah, and that's the thing I think with peptides, they kind of do a lot of things where, like, if you just give IGF-1, you're just kind of doing one thing,
Yes,
and
I think that integrative approach was much more physiological. It's more what we are. And so if we move on to some of the other musculoskeletal things that I do, my favorite cocktail, if you will, for anybody over 35 or 40 that is having some issues or starting to get burned down like I was, is I like to give them a growth hormone releasing hormone and peptide that doesn't raise their appetite and doesn't raise their IGF-1 too much. And then I like to give them BPC 157, which is a very powerful reconstructive, reparative, anti-inflammatory type of peptide that Pavlov discovered at the turn of the century, and then in 64 or whatever it was in Eastern Europe, they rediscovered it and found a way to synthesize it and stack 15 peptides. And now it's probably one of the most used peptides in the world, and probably the safest in the world. And you can bathe in it and not get sick from it.
Yeah. Now, is that cocktail shaken or stirred?
I drink everything straight up.
All right. Good joke. It's getting late. But yeah, the BPC, it does so many things, and I give lectures on it, and you list everything it does. It's almost embarrassing because it sounds like snake oil,
It sounds like Dr. Hook's medicine show.
Yeah.
But I can tell you, I'm going to stay on this stuff the rest of my life and afford it. I'm almost 70.
The FDA is trying to take all this away, trying to take hormones away, thyroid again. It's crazy.
As I say, I'm almost 71 years old. I function at the level I was when I was 35 or 40.
You look great.
I feel great, and I want to stay off the porch.
And have you noticed how many people feel great? Like at a party, I'm telling you, either someone always comes up to me. It's either them, their family member, their friend is so sick. And I think 10 years ago, I didn't get that. It's like everyone's sick, and you're saying I'm feeling great. It seems that's so rare now,
Yeah, it is rare unless somebody's doing something. And there's so few of us that have found that holy grail to where we can work together. Are you still there?
Yeah.
Yeah. Okay. So we've found some of the holy grail, and we're hanging on to it as long as FDA didn't take it away from us. And we're certainly doing no harm. From what
that's the thing. Show me someone who's been harmed. And if it actually works and is safe, they're more likely to take it away because they're the basically enforcement arm of big pharma.
Well, let's shift over to the thymus peptides, the thymosin alpha-1 and the thymosin beta-4. Those are the two predominant ones. And thymosin alpha-1 is more of an immune modulatory peptide, and thymosin beta-4 is more of a reparative recovery type peptide. They both work in the brain. They both work on the hair. They both have wide spectrum of benefits, kind of like BPC 157. I use, alpha-1 for thymosin alpha-1 for people that have viral syndromes. Like my granddaughter got mononucleosis with cytomegalovirus. I put her on everything known to man, the ultimate cocktail. I brought her over here from UT and bedded her down for 3 days, and I had IVs running with vitamin C and quercetin and high dose vitamin C, zinc, everything known to man, and put her on thymosin alpha-1 twice a day. And that girl was flat on her back, moribund. Within 36 hours, she was up smiling, running around.
Yeah, it's approved in 30 countries for everything from cancer, infections.
Knowing what I know about mononucleosis before I knew anything about mononucleosis, you don't get up that quick from mono.
Yeah.
It kicks your butt.
And that's the thing, like how many, it's commonplace now, I think, with the peptides, and they saved my life. I see it with so many people, versus my heart failure and the
Yeah.
Lyme when I had it, is that it's, what do we have that's so safe and you get so many profound benefits,
I mean, there's nothing out there that has a blunt edge on the backside of the sword. We have the ability to carry sharp knives, and we have and most of the time our knives are sharp on both edges.
Now, are you using TB4 frag?
I'm using, well, now I am.
I'll say we'll send you some. Yeah.
Well, I've got some, but I've been using TB4 injectable, and then recently started using the product that your organization manufactures, and then my latest order has the TB frag. And
we love feedback, so we're going to start an IRB, and we want to gather data. So
let me just capsulize real quickly my protocol for, say, a orthopedic surgical patient. I've got 2 or 3 patients right now that are recovering from ACL reconstructions, and I put all those people on TB4, on BPC. I put them on one of the growth hormone peptides and growth hormone releasing hormones. I put them on. Now, the only reason I don't is if they're in competition or getting out of competition testing, because TB4 and the growth hormone peptides are WADA negative. They're WADA bad. So WADA will not allow you to do that. They're considered performance enhancing, and you can't do that on people who are going to be tested. So you got to be careful. That's a disclaimer.
Doesn't mean it's dangerous. It means it gives you an advantage.
They convert a 3-month ankle sprain into a 3-week ankle sprain, and I've seen it over and over and over again. Partial rotator cuff tears. They re-knit the tissues back. Now, they won't reattach the tissues that are pulled off and on the other side of the room, but they'll help heal it once you put it back.
So have you seen really significant reduction in that recovery time?
Well, let me put it this way. Yeah, the answer is yes. I don't want to be a politician and dodge the question.
In Texas.
Yeah, the patients that I've worked with have shortened their recovery time significantly, to the point that they go in and they're not telling their doctors what I'm giving them. Because I told them, I said, it's probably not a smart idea for you to discuss this before with your doc, because he's going to say I'm crazy, you're crazy, and it doesn't work, and he doesn't know anything about it.
If a doctor doesn't know about it, it's quackery. And I mean, it's, if they don't know about it, they're leery. And
but what happens, they go in and they're going like, you are doing so well. And the patients come back to me and say, what did he mean by that? I said, he's just telling you what I told you before I ever told you we're going to do this. You're going to do better than the average patient. It's not magic. You're not Wolverine, but it's just going to optimize your system. And so, I've got another guy right now that just underwent a wide excision of a squamous cell, or maybe pre-squamous cell. He'd had several large biopsies, and then finally I told him, I said, quit screwing with this thing. Go get the damn thing widely dissected and get it out of there, because otherwise you're going to have mets to the brain. And he's a former TCU football player, defensive end, big, strong guy, like years ago. He's now 55, but son lover, he skis with me. We out at the lake drinking tequila, so we know each other real well. And I told him, quit screwing with this. Go tell your dermatologist to cut this damn thing out and get a wide margin and send it to pathologist and make sure the margins are clear. And he said that after he went in for his first visit, she says, I can't believe how fast you're healing. Well, we know this from the plastic surgeons and the dermatologists that are doing elective procedures, and they're doing other procedures for breast reconstructive and things. They're using exosomes, they're using peptides, they're using all this stuff.
Did you know some cosmetic surgeons doing that? I haven't found any. Yeah.
Absolutely. Greg, I'm blocking his name right now. He's has practice in Cincinnati and Newport Beach.
Hey, it makes them look good,
Oh, I mean, and he does research with it, where he does one side with and one side without, and he does photos. And I've been to his lectures, and it is dramatic.
Oh, I'd love to see those. Yeah.
Yeah.
Because I had, I broke my nose.
Yeah.
Skateboard accident, and big gash, and it was like split open, and
I can't even see it now.
Yeah, and I swear, overnight, people go, that was just open. It was like separated the night
Sure.
before. Yeah.
Yeah. Well, I mean, we know BPC 157 works in corneal abrasions. It works in dental scenarios with gum issues. It works in ulcers.
You actually used the BPC and TB4 for dry eye. It works well. It's actually in clinical trials for that.
It works incredibly well in most of the tissues in the body. So, and then we're kind of run out of time, but from the standpoint of other things that we can do, and we can always do a second phase of this if you want at a later point, but 2.0 is that GHKCU, which is a trivalent peptide that captures copper in the middle. I'm sure you're aware of that. Works great as a foam on the hair. I literally grew back my little bit of a bald spot in the back of my head within 6 weeks. It works great as a cream on the face for minimizing wrinkles. It increases the dermis. It grows collagen, and it increases the dermis thickness, minimizing fine lines and wrinkles. It helps in terms of away from that, going back to orthopedics. It really does accelerate the actual collagen growth and production in healing tissues, muscle, tendon, and bone. And in combination with TB4, TB4 has a predilection to restore the normal collagen and to diminish the scar collagen so that you don't have scar to deal with and you're healing naturally.
It really reduces formation of a fibrous tissue, or
Exactly.
even like, diabetics, they get, fibrotic kidneys, liver, so reverses that. Now, are you injecting GHK?
Yes, I inject it, and I use it topically as well.
Okay. What type of dose are you doing?
I use about 10 units, about 1/10 of a cc, and I'll sometimes do it twice a day.
Okay, and I guess what depends on the size of the vial. How many milligrams is that? Grams?
You're gonna make me lie here. I don't remember.
Usual dose is like milligram or 2 milligrams.
Yeah, and I've gone back and looked at it all, and I've looked at the numbers, and to the point that I just do it by rote now that I don't pay attention to the dose. But what was I going to say with respect to with fibrosis, as you were talking about? I like this. I'm a keep it simple, stupid guy, KISS principle guy. And for me to understand how this stuff works, I've come up with these kind of models in my brain. And when we have a tissue or an injury that occurs, the normal process is, it starts out with hematoma and then fibrosis and then alignment and hopefully collinear bonds between the collagen molecules, et cetera, and things line up and they get better over time. And if you're lucky, they don't stretch out or they don't lump up and don't form keloids, or they don't give you an elongated tendon and a loose knee or an ankle or whatever. What we know is that for the most part, healing is by natural, what we call either early primary intention or secondary intention, is basically it's like throwing down pickup sticks like when you were a kid. You know that game where you have those little plastic sticks?
Yeah, they're going to be all over the place.
You throw them in there, you throw them down on the floor, and then you align them. Well, as our bodies try to align this stuff, hopefully they align, and they align side by side, but they don't always, and they end up sometimes a mess. And so and I don't know how, I don't know why, but thymosin beta 4 allows the alignment to occur more in line with the forces to give you a better strong tendon with less scar and less restricted range of motion, more pliability of the surrounding tendon and muscle. And I would love to know the research behind that. I just don't know. I haven't delved into it.
I'd love to see your side. I'll send you the research. I was going to ask you, have you seen people like this big scars that get better, keloids and things like that? It's just not really our population. I can send you the studies. I just was wondering if you've seen
it's not something that I have dwelled on, but I know that Greg, God dang it, I can't remember his name. Greg has dealt with that. He does biopsies and he's a very scientific guy. And he's done all this stuff, and I'd love to put you guys together. He's out there with you. He's in Newport Beach, and he could have a nice conversation with you the next time you're near one another. And he's got stuff that shows what both exosomes and peptides and everything else does.
Yeah, and that's really I love stem cells, exosomes, and like it's interesting that stem cells will secrete TB4, the exosomes will have that in there. And also TB4 stimulates stem cells.
And that's the other thing. Yeah. That's the other thing is that we know that TB4 is not an extraneous material. It's a natural thymus produced and tissue produced hormone or peptide that modulates healing and growth and wellness overall, including traumatic brain injury. I think you and Kathleen have communicated, and she treated her own son with thymosin alpha-1, thymosin beta-4 when he got his brain turned to mush with a crowbar out in LA. And he's back in full classes and doing everything else after she nursed him back to wellness. And then you hear the stories about a complete hair loss overnight. The kid wakes up and all his hair's on his pillow. Obviously some sort of autoimmune reaction. And TB4 and TB alpha-1 and GHKCU and all these different peptides regrow a full head of hair in less than 6 months to a year.
Yeah, she has some nice slides on that. It basically totalis, where you lose all their body hair.
Right.
Yeah.
Right. It's crushing to these patients when it happens. You have a 13-year-old kid lose all his hair,
Yeah.
So
do you use other ones, Aptalin? Have you got into the melanocortins for inflammation or delta sleep or?
I've used my memory. I've used Epitalon. I've used cerebrolysin. I've used DSIP, delta slow wave initiating peptide, for sleep, and it's dramatic. One thing I discovered that I finally convinced my mentor, Bill Seeds, after about 6 months to a year, that it did raise testosterone levels in men and women.
Oh, yes, we've seen it significantly. And is it because they're sleeping better or it actually stimulates? It seems to be both.
Well, there's some actual research that shows it works through luteinizing hormone centrally, and that's probably the pathway. But nonetheless, I know I gave it to my wife because she was having horrible insomnia, and she just absolutely broke out the worst cystic acne you've ever seen in your life. And it took me about 3-4 weeks to get her levels down. I had to get her off of it, and she could, no testosterone, no nothing, and just totally cleared her receptors. And it took forever. And it was the DSIP that did it.
Wow. Yeah. So she kind of went back to age
14,
16. Yeah, whatever. Yeah. And I've had, because I'm a terrible sleeper. And it's the combination of delta sleep, Aptalin, and either, CJC apomorelin or some sort of growth hormone releasing hormone has just been tremendous.
Makes a huge difference. And there's so many more of them out there. I've used...
We're using more pinealian instead of Epitalin. It's a shorter peptide and orally available. And
I'm not familiar with that one, but I haven't been into books in a while, and I'm probably losing ground. But there's so many of them, CLANC and CNAC and cerebrolysin. I've used 5
and then cerebrolysin, FDA took that away. But it's available orally now, which is shown to absorb with studies on EEGs and things like that. So that should be available soon as well.
Heck yeah. And then what was I thinking of? I was using 5-amino and
talk about your experience with 5-amino, because we may be able to get that back.
I have limited experience with it because it got busted right at the time I started using it in patients and myself. But I've had any information from other people. For example, a 40-year-old guy that played basketball every day said he took it for 6 weeks and he increased his vertical leap by 5 inches.
Wow.
So that's a case of one. Who knows?
Yeah. But we've had, it's my, like, too much different, but my assistant was just basically, I don't want to give too much information, she doesn't mind, but it just changed her whole mood. People with OCD within 2 days, it's like they're better. But so it's a mitochondrial peptide. It increases NAD in the cell. And there's so many trials now with mitochondrial peptides, because as your mitochondria, as you get older, basically slow down, everything slows down.
Sure. Well, and that's kind of a big part of my practice is mood and depression and things like that. Just as a result of the patients I see a lot of 30 to 50-year-old guys that are traders and hedge fund guys, and they let their butt get a hold of the intellect, and they're working themselves to death. And they got kids and wives that are unhappy because they're never home. They're up at 3 a.m. because of international business, et cetera, and they're traveling. And they get all strung out. And the next thing you know, to get up, they're to do an Adderall to go to bed. They're taking Xanax, and they're drinking, and they say, look, I got to get off this. I get off this. Yeah. So I have really a fairly robust NAD practice where I do a string of 5 days of NAD at 800 milligrams IV drip, and it literally clears the brush in front of them after 5 days.
Yeah, it's nice. So, NAD, stimulates the mitochondria.
Yep.
And I like using that with the 5-amino because you get the 5-amino blocks that accessory pathways, so you get even higher levels.
Do you know if that's available somewhere now?
Well, in my drawer, but
yeah,
I hoard it. But it should be available again. But
I've got a bottle full, but I'm getting low. The other one is the SC. I know I've guinea pigged my own son on a little bit. My older son, he's 47, and he told me one day, he says, Dad, I've been on this SC for 6 weeks now. He says, I swear to God, he says, I am 47 years old. I haven't been this ripped since I was 17.
Yeah, it's kind of amazing that, and yeah, we've had, in fact, another doctor in our office has told me, it was like probably 3 weeks ago now, but is that she had a diabetic patient and just, nothing really worked to lower hemoglobin A1C. Put her on C and just dramatically dropped her hemoglobin A1C. Her triglycerides went from like 600 to 104.
Oh my God. Well, I can't take it because it nauseates me and it creates a welt on my injection site. I don't know why. I don't know.
I have the same thing. I'm a big fan of follistatin.
I have never tried taking follistatin.
Yeah, and that's one of those things that seems to work. It works for weight loss and kind of muscle growth, but it either doesn't work at all or works amazing. Like we'll get some women come in and go, I got a wedding in 2 weeks. I need to lose 20 pounds, Yeah. And it can work. Very hard to find, very expensive, but I'm allergic to it. But I also found is that when I was sick, is that I ended up being like allergic to everything, but then when I got well, I wasn't, so I was so mast cell activated.
Sure. And I've got 2 patients right now that have mast cell activation syndrome. And I wasn't going to mention it, but I will. I started experimenting a little bit with oxytocin, and then with oxytocin being kind of a nesting hormone for relaxation, et cetera.
It's an immune modulator too.
It is. And then I added to that microdosing ketamine.
I love the ozone ketamine NAD combination IV.
Right. I haven't done that. I've done nasal spray, ketamine microdose with oxytocin. And I'm telling you, I have a drove of patients that love it. They say it's basically cut out their alcohol use. It's eliminated nicotine. They don't take any Adderall. They don't take any Xanax.
So you're sitting in oxytocin?
Oxytocin and ketamine microdose.
And ketamine, when you say microdose, well, what do you do?
Pharmacy again, don't get me lying on the dose. I should remember it, but I don't. I can send you the details on it. But I have a pharmacy that compounds it for me in a nasal spray. They do 1 spray in each nostril before they go into a social event where they've got social anxiety. And they don't pick up a bottle of tequila. They can get by. They're wonderful. They're great.
And we're actually using a lot for pain. And, now a lot of insurance companies are not even covering doctors they write for an opiate. It's just all these people are in pain. And we found you use ketamine, they really come down on their opiates.
That's a good thought, and I haven't done that, but it's probably another market for the product.
Yeah, like regional pain syndrome, just regular pain, and we don't find people abuse it. It gets a bad rep.
I've got one guy that I'm not sure he abused it. It's just he had such a absolute horrible activation syndrome, SSL activation syndrome, that it worked so well. It was the only way he could live. And,
is that an addiction or you don't want to feel hard?
So what I did is I cut him off and sent him to a ketamine clinic and said, look, you need somebody to monitor you more closely than I can.
Yeah,
And
the thing is, I mean, it's very safe because, they give it to kids in the ER because it doesn't suppress respiratory. And we've had people come in the worst pain. The doctors just leave them. And the problem is doctors are scared to death to write for an opiate, right?
Yep.
And they send them all to pain doctors and they can't get in for months. And now the pain doctors won't write for opiates. What's the alternative? They give them like gabapentin and, but we had also IV with one patient on fentanyl, fibromyalgia, chronic Lyme, and was getting stem cells. And we gave a big dose of TB4 to see what the stem cells. And she goes, my pain's gone.
wow.
Yeah.
Yeah. Well, there's a whole lot more of this story.
Yeah, and that's a nice thing is they work very well together. They're very synergistic with so many things, and they're safe.
They are safe.
And they'll actually, instead of worrying about giving you something, it will protect you from the overdose of BPC will protect you from overdose of alcohol, of antipsychotics, of Tylenol. So they're interesting stuff.
Well, one other thing with respect to BPC is that using it in combination with a corticosteroid, it negates the catabolic effect of the corticosteroid in the tissues, but allows the anti-inflammatory effect of cortisone to work. So that's a great benefit.
Yeah. It's just, I get embarrassed to say how many things it does because no one believes you, and
right.
I'm trying to think if I've seen a side effect. I mean, we treat some of the patients that are sensitive.
I have seen zero side effect.
Yeah. Some people see a little insomnia because it is activating. People say that their brain clears up. So some people will kind of say, hey, a little hyper. But for 99.99%, I mean, you can't overdose on it,
Right. Well, I think we've probably used up my time.
Well, thank you. Yeah, I love, getting, all your experience on the ground. You've had a lot of experience, very interesting story, how, you went from the dark side and you gave up a lot.
Well, yeah, I mean, I always say, came from the world of being strong as an ox and twice as smart. But I get to utilize all my education in this.
Yeah. Yeah. It's like I started anesthesia because I was sick and I figured it was the only thing I could do. Because it was so exhausting talking to a patient, and then you get better. No offense to the anesthesiologist, but I'm like, it's, but I'm just so excited about this stuff. And
orthopedics was a lot of fun, but it's also a pretty brutal profession. I mean, it takes a lot of effort, in an operating room, 6, 8, 10 hours a day, and you're physically active. And I mean, that's good and bad. It keeps me in shape.
Surgeons.
I had to stay in the gym to stay strong enough to do what I did. And plus, you're standing on it, but it does have a negative effect because you're bent over all day long. Your ligaments in the back of your neck and back are stretched out. Your feet hurt, your knees hurt. You don't hydrate enough, so your kidneys go to hell.
It's like one of the doctors don't live as long. And think about it. What job do you have to be so constantly focused for 5 hours, 6 hours, Yeah.
I mean, my record was a 16-hour replant in residency.
I mean, they wouldn't do that. It'd be basically, malpractice or whatever for an airline pilot to do that or something.
Right. Right. But it was a sign of strength and victory for you to be that strong and do that,
Yeah.
Well, no more.
So great. Have a great rest of your day. I appreciate you taking the time. I think, we got some good information and, kind of from the horse's mouth. No, it wasn't being anything bad by that. Just, you've kind of gone through the progression and seen it and I love it. You're just, adopting new therapies and.
Well, I want to learn. I want to pick your brain and learn more about the science because I've had so much. I'm spending so much time digitizing my practice and virtualizing it that I really have kind of fallen off the educational plateau a little bit.
It's tough, trying to manage and.
Management is always the hard part. But I've got a good person helping me, and I'm getting it back together. I've got a lot of people that are mentoring me that have already been through it, and it's really helping a lot. So I would like to stay connected with you, and
we're going to actually start trainings. So,
Yeah.
and really, and there's some other good trainings I can send you to, but we're gonna start some and really just, I feel I have to give back because it saved my life. You know, it's like Lyme. It's like treating Lyme patients. People go, oh, do you do it for the money? No one treats Lyme for the money. I'm just like the worst thing you could think of doing, because it's tough, but
it's like a religion.
Is that I think
Well, to the extent that I can contribute to your training and education program, I'd be more than happy to be involved.
Awesome. I love it. Yeah, it's I'm telling you, I'm a little disappointed in doctors coming out of medical school that, they just memorize, they don't understand concepts, and they just want to show up 9 to 5, and it's a different world.
There's no more William Oslers.
Yeah.
Okay.
No more physical exams.
No. We learned all that, but they don't do it now. All right, Ken, I'm gonna go and talk to you soon.
All right, my man. Hey, thank you so much. Appreciate you taking time. I know you're busy. I think it was great, and we'll be talking.
All right, bye.
Great. Take care.
Thanks for joining us on the Peptides and Longevity podcast. If you enjoyed today's episode, don't forget to subscribe, share, and leave a review. It helps us reach more listeners passionate about optimizing their health. For more insights, resources, and updates, visit our website at www.holtorfmed.com. Together, let's embrace a future of health and vitality. Until next time, stay inspired and keep thriving.